everyone. This is Molly Lindquist, part of Team Manta Cares here for our podcast club. For those of you who don't know, the podcast club gives members of our community a chance to respond to some of our PCORI-funded podcasts. So I'm really excited to have my friend Molly MacDonald here. Molly is a breast cancer survivor. I've known her for many years, thankfully. I feel like in our world, that's always good. And she founded the Pink Fund based on her experience. So today she's going to tell us more about the Pink Fund, and then she's going to give her thoughts on Dr. Elwyn and Danielle Schubbe's episode 38, Am I Making the Right Decision? So we'll talk about that as well. So with that, Molly, I would love for you to tell everyone a little bit about yourself, about your cancer experience, and about the Pink Fund.
Okay, so first thing is I came clean about 2 weeks ago and confessed that I'm not really the founder. I co-founded the organization with my husband, but I always claimed to be the founder. And really, I'm the visionary, and he was the person doing all the back end work. And so I had decided he had recently completed treatment for tonsil cancer, and I decided he really needed credit for all that he has done. So literally, without him, there would be no Pink Fund. And I think that one of the people on staff said every visionary needs their Tom, like that person who's going to execute the vision.
Yep.
Often visionaries aren't able to execute the vision, and I can do some of it, but not all of it. So anyway, Pink Fund was born as a result of my diagnosis of early stage breast cancer in 2005 at a time of job transition. I'd been through a financially devastating divorce. I had 5 children. I had remarried a few years after the divorce, but I was in very bad shape financially. My former husband bankrupted us into the millions of dollars. All the cars were repossessed. The house was sold at a sheriff's sale. We lived in a big, beautiful home. We were 1%ers. We had everything most Americans gamble and buy lottery tickets for, and it was all gone. And so I was thrust back into the workforce after being out 12 years, wiping butts and noses of these 5 kids. So, and I was middle-aged, and that was really a challenge. So I left in 1997, so 26 years ago, middle-aged was very old. Now I'm still younger than both presidential candidates, and I'm considering a run myself. So
Molly for president.
Yeah, right. So it was really tough, and I segued my career away from PR and marketing and journalism into sales, because at the time I had these 5 kids, an aging mom, and I knew if I was selling, nobody cared where I was. It's not like today where you can work remotely and there's much more flexibility. Back then, you were in the office at 8 a.m. and you stayed till 5 or 6. So anyway, I get this job. I'm going to be part of a woman-owned division of a company that printed large and grand format graphics out of another state. And I get the diagnosis. And so I felt that I had an ethical responsibility to share this information with my employer. And we decided it wasn't the best time to move forward. So now I'm unemployed. I'm essentially unemployable because, how do you get a job when you say, I'm going to have to be gone quite a bit, treatment, surgeries, etc. And I have a COBRA premium of $1,300 a month, and this is $2,005.
Wow.
I was not eligible for Medicaid. Now, if that had happened under the ACA, I would be able to change insurance plans because of a change in circumstances. But back then, it was predicated on my previous year's taxable income, which knocked me out of Medicaid. So it was either pay the COBRA or no treatment. So we're scrambling to pay the COBRA. My husband works in the luxury piano business, and also on the concert stage as a piano technician. And so his income was completely, unreliable. We never knew when a performing artist was going to come to town and get a call 2 or 3 days that they needed concert grant, and et cetera, et cetera. So within about 3 months, we're not able to make the mortgage payment. And I was not getting any child support. I had no alimony. And like 62% of Americans, I had less than $1,000 cash on hand. So we were already strapped. And I'm going through treatment. House falls into foreclosure. And every 58 days, my automotive creditor is calling, asking me, am I going to make a payment? Am I planning on making a payment, or should they plan to repo my car? So I pulled out that cancer card and said, please do not come get my car. Give me another week. And because if you get my car in our country, public transit isn't available to everybody. So if you get my car, number one, there was no Uber or Lyft either back then. So can't get to treatment. I suppose I could have walked or ridden my bike, 5 miles. Couldn't get to a job because any job that back then you had to show up. So losing a vehicle the potential of that was very frightening. So now houses in foreclosure, vehicles under threat of repossession. And by the end of treatment, I'm being threatened with utility shutoffs. Now, the real moment of, I call it the epiphany for me, was sitting in the treatment waiting rooms with other working women like myself who had much more aggressive disease, longer term treatment protocols that were physically more toxic and certainly financially more toxic. And they were concerned that their treatment protocol was going to outlast their Federal Medical Leave Act benefit and that they would permanently lose their job. And some of them had worked for companies for which they were building, credibility for pensions for long-term retirement. So as I listened to them thinking, well, they would stop treatment and go back to work, or they were going to liquidate their IRAs. They were going to put their house on the market. They were going to pull a kid home from college. And I was like, oh my gosh, why isn't somebody helping with this? So I went to the social worker at the hospital and I said, does anybody help pay any bills for this? And she kind of looked at me like, what? She said, well, I could give you a debit card, like it was a, $50 card for whatever. And that wasn't going to work. So I went home to Tom, my husband, and I called Tom Terrific because you have to be terrific or insane to marry a twice divorced, middle-aged woman with 5 children, night sweats, and a mildly demented mother. So I went home to Tom and I said, I have this idea, Tom. I think we should start a nonprofit. Now, mind you, I had no nonprofit experience. I'd been in the junior league. And yeah, I volunteered for stuff, but I had no idea how to run a nonprofit. I didn't know anything about governance or any of that. Right. So I went home and I said, here's my idea. We're going to start a nonprofit and we're going to pay these women's bills to their creditors, these non-medical bills that are non-negotiable for 90 days. And he's like, you're in line at the food bank now to help feed the family. Wow. We've just rescued the house from foreclosure with the help of your mother. Yeah. And he said to me, he thought, in his head, because Tom doesn't speak a lot, he's in his head, he's thinking, I know you've lost your breast, but now you've lost your mind. Like, what are you thinking? And I said, but in a lot of my talks, they say, well, because he sleeps with me, he went along with it. Because it was like, be in my bed or there's a couch. Right. So but he had seen me kind of pull the rabbit out of the hat a few other times. So I think he had some sense that maybe we could make this happen. So we bootstrapped the whole thing. I had an Eero Saarinen tulip table that I traded for our heart and ribbon logo. Wow. We got a donated website, and the medical writer at the Detroit Free Press, where I had once been an executive, wrote and published a front page story on my vision and efforts that ran on Monday, October 2nd, 2006. And then 27 newspapers picked up the story, and we were off and running. So fast forward, I made vision boards. I put some corporate partners on it. I knew that the problem we were trying to not solve, and not put a Band-Aid on it, but I describe what we do as kind of putting scaffolding around a family that's financially falling apart. So we're not going to solve this whole thing, but we're going to stabilize them. And we call it kind of a financial bridge. Yeah. So she wrote the story, 27 newspapers picked it up. And for the first 6 years, we were all volunteer. I put the Ford Motor Company Blue Oval on my vision board in 2007. I'd actually gone to a breast cancer retreat where I was scholarship to go, a survivor's retreat in Colorado. And at the end of the retreat, they brought out the foam core and the glue sticks and the magazines and the scissors and the markers. And I'm like, oh my God, we're going to have to paste stuff and cut it out. And I didn't want to do it because just not who I am. I'm not a scrapbooker or any of that kind of thing. Right. But, I was scholarship, so better go along with the program. So anyway, I cut out that Ford Blue Oval and put it on the vision board. And then in 2012, 5 years later, Ford called me and said, we've heard about what you're doing. and we're thinking about diversifying our program. At the time, they were working solely with Komen.
Mm-hmm.
And we'd like to invite you into, kind of pitch your value proposition. Well, the beauty of it is that what we did, nobody else was doing. So we weren't competing with Komen. We weren't competing with anybody else. So our organization at the time, our annual revenue was $168,000. We had one part-time employee, and it was not me.
Yeah.
And we were working out of donated office space. But Ford picked us up and launched a national ad campaign for us that had a fair market value of just over $7 million. Now, they didn't pay that amount because they have great buying relationships, but had we had to pay that, that would have cost us. So our $168,000 wasn't going to cover that. Yeah. And that's what really kicked us off.
Wow, that's
so
amazing.
Fast forward to today, we have scaled. And the condition on which Ford picked us up, though, however, was that we would go national. Mm-hmm. And that was actually on my vision board, that we needed to be national.
Right.
And so they will always hold that honor for taking us national in 2012. So we've now paid out $7.4 million. Well, as of last night, $7.5 million in bills to patients' creditors.
Amazing. Wow. I think this is, wonderful, clearly what you're doing. And I think it actually kind of feeds right into what we're going to talk about with the podcast too, because a lot of the podcast was really a discussion on shared decision-making and integrating patient preferences in with clinical guidelines. And then also kind of making decisions for your future self, in the moment, which of course, none of us have a crystal ball.
Right.
I would like one. But I'm curious, to get your thoughts on the idea. You mentioned, the women that you would go into treatment with who, are on the financial edge. And, I think we often think of our doctors giving us, you need to do this much chemo, this much radiation. But as a patient, we're often, factoring in a lot of other things. How do I get to the clinic? Can I miss time at work? All of these different decision points for us, just from a logistical standpoint, factor into this kind of clinical opinion of what we should do. So I think, what you have described is exactly that. It's how do you continue living your life when you've been thrown this wrench that impacts every part of it. So I'm curious if there are any stories of, clearly your story illustrates that completely, but anyone that you funded in the Pink Fund that comes to mind when you think of those types of choices people are making?
Well, there has been a study here in Detroit, and the name of the study author is slipping my mind right now. But she was doing a study where she filmed oncologists at a National Cancer Institute with the patient at the time the treatment plan was presented. The oncologist was most concerned that the insurance would cover the prescribed plan. The patient was most concerned about lost income. The oncologist then responded, well, we could give you a lower dose. Now, this is a physician who is trying to balance treatment with what the patient is concerned about, with a very uncertain outcome, right? When you prescribe a plan, you are assuming that this is the best plan for the patient based on everything you know about them, including any of their genetic predispositions.
Right.
Maybe their race, their ethnicity, their income, their education, all, where they live, how they're going to get to treatment, what their copays might be, what their deductible might be. But that's the physician's job. It is not really the physician's job to know how much the treatment's going to cost or try to figure out how the patient can afford it. The concern, particularly in the Black community, we see such a higher mortality rate of about 42%. Now, some of that may be diagnosed at later stages, but I begin to wonder if some of that might be treatment non-adherence, like not showing up because I have to go to work, or I need a babysitter and I don't have anybody to watch my toddler. I can't afford daycare. All those things that factor into this shared decision making. But I have come to the conclusion, and this is something my surgeon said to me, and it really resonates with me through all of what I call the treatment time and the timeline. she offered me two options. You can have a full mastectomy and you're done, or you can have a partial mastectomy and 6 weeks of radiation. She said, the research shows that the outcomes, as far as we know now, are identical. And I said to her, well, if it were you, what would you do? And she said, well, the thing is, it's not me, right? And I don't have to live with the outcome. So in my never to be humble opinion, the physician's role is to tell you and recommend what he or she believes, based on the research and their experience, is going to provide you with the best long-term survivorship. It is the patient's job to determine if they can even, afford all that either that time off work, will they lose their job, that copay, by the way, that insurance plan. We just read about this the other day, which I've always said, when patients elect an insurance plan, they most often elect a plan that they can afford the monthly premium. Because they don't say, oh, but that premium comes with an $8,000 deductible for me and my husband and my family or my partner. But, I don't have any history of cancer in my family, so I don't have to worry about that. And then, they get a diagnosis in November, and that deductible is going to reset in January, and it may be such that they can't wait till January to begin treatment.
Yep.
So that's a huge cost consideration. But in any case, I say this a lot about life. The physician is responsible for the input, for making the recommendation, using the science available. They are not responsible for the outcome. And the most amazing thing to me that I've read about that I don't understand is when they talk about the exceptional responder. Have you heard about that?
Yeah.
So it's same patient, same age, same race, same disease, maybe same genetic profile, exact identical treatment. One lives, one dies. Right. There's just so much about science that we don't know yet. So when we talk about shared decision making, I think if I were in a physician's seat, that I would share everything I know with the patient, point them to other resources, suggest second opinions, maybe even third opinions, and then really sit with them and say, I can't make this decision for you.
Right.
It is my job to provide you with everything I know and all the resources available at my fingertips, but I can't make the decision.
Totally. I love that. Molly, on that note, I think that was such a poignant way to end this podcast club. Thank you so much for being a part of this with us. Everyone, check out the Pink Fund. We will link to it in the show notes from this. And Molly, I wish you and Tom Terrific all the best. And I hope that his recovery is going well from his cancer, which little plug for an upcoming episode with Molly and Tom Terrific, where you'll get to hear their story. So thanks again, Molly.
Thank you very much.
This episode was supported by an award from the Patient-Centered Outcomes Research Institute. This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The content here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.